Hello and welcome to day 3 of our New to Medicare series. I'm Danielle, co-founder here at Boomer Benefits, and today we're going to talk about signing up for Medicare. You're eligible for Medicare at age 65 regardless of whether you are taking any Social Security income benefits yet. However, even though you're eligible at 65, when you actually enroll in Medicare depends a lot on whether you're still working. Many people work past age 65 these days, and they may still have group health insurance through their employer. Medicare benefits can coordinate with that employer coverage, but how it coordinates depends on the size of your employer. If your employer has more than 20 employees, your group health insurance will be primary and Medicare will pay secondary to that insurance. In this situation, most people decide to enroll in only Part A. That's because, as we discussed in an earlier video this week, Medicare Part A doesn't cost you anything, and it could reduce your hospital expenses if you have an inpatient stay. Parts B and D, however, have monthly premiums that you pay. So since your employer coverage already includes outpatient coverage and drug coverage, most individuals will delay their enrollment into Parts B and D so that they can save those premiums while they're still working. Now later, when you retire, you'll have a short window of time called a special election period to enroll in Parts B and D, and there won't be any late penalty. On the other hand, if you work for a small employer, Medicare is primary and your group coverage is secondary. So in that case, you should absolutely enroll in Medicare Parts A and B at age 65. The same applies for retirees. Medicare is primary, so you'll need both Parts A and B if your former employer provides insurance. You can learn more about Medicare's coordination of benefits by visiting the Boomer Benefits website. We have a Medicare and employer coverage page which will help you, and I'll link to this in the email. So that covers people who are still working. Now for those of you who are not still working, Medicare is going to be your primary coverage, so of course you'll want to enroll in both A and B at age 65. If you're already taking your Social Security income benefits prior to 65, your Medicare card is just going to show up in the mail shortly before you turn 65, and you won't have to do anything at all to activate it. However, if you're not taking income benefits, then you'll need to initiate your Medicare enrollment yourself. You can do this in person by visiting your local Social Security office, or you could apply online at the Social Security website. You can also call to request an application be mailed to you, but be aware that this option can sometimes take several weeks, so be careful with that one. I should also mention that if you're a retiree of the railroad, you would apply for all these same things at the Railroad Retirement Board office. Medicare gives everyone a 7-month window to apply for benefits, and this is called your initial enrollment period. It starts 3 months before your 65th birthday month, runs through that month, and goes for 3 months after. If you enroll during the 3 months prior to your birthday, your benefits will usually begin on the first of the month in which you turn 65. You can also learn more about signing up for Medicare on our Apply for Medicare page at the Boomer Benefits website, and I'll link to that in the notes in the email as well. So that's it for signing up for Medicare. Tomorrow we'll discuss Medicare doctors and how you can ask the right questions to find out which Medicare plans your important physicians participate in. Thanks for watching, and I'll see you in the next video.